Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello, welcome to Health Watch on Advent Cable Network Nigeria. I am Angela Wenze. The growing number of people living with diabetes mellitus in Africa is worrisome, and an explosion in these numbers may be imminent if urgent measures are not taken to address the trend. It is estimated that by 2040, the global prevalence of diabetes is likely to affect 10% of humanity. Report by the International Diabetes Foundation estimates that 1.7 million Nigerians are diabetic. Now, the sad part of this estimate is that there are likely some 70% of people outside this estimate who do not even know that they have diabetes and may be treating themselves for something else. Experts say that Africa, and Nigeria in particular, is likely to experience the highest increase in the near future. Out of the many Nigerians who are being diagnosed, just a fraction of them are receiving proper care and treatment. So, if you're watching me today, you most likely know somebody who is presently suffering from diabetes, or you may even be suffering from diabetes yourself. I think you tuned in right on time. We shall discuss diabetes mellitus with focus on management. My guest today is Dr. Chibuike Chimdi. He's the specialist family physician at the Maitama District Hospital in Abuja. Dr. Chimdi, you're welcome to the program.
Thank you, Angela.
The last time you came, we talked on, I think we spoke on stroke and stroke management. So today I brought you here to speak on diabetes.
That's great.
Okay, so let's start with, when you hear diabetes, what comes to your mind is sugar sickness, sickness of sugar. That's what the average man thinks. But just to make it clearer to us, what exactly is diabetes? Let's start with that.
Diabetes mellitus is actually a problem, a metabolic disorder.
Metabolic disorder,
Metabolic disorder that has to do with how the body handles carbohydrates, protein, and lipids. Lipids, the ordinary person will call fats.
Fats, okay.
So these are the things that when the body handles them, degrades them, digests them, they are converted in a form that can produce energy. The body system have a way of adjusting and utilizing energy.
Okay, and energy from the foods that you consume.
From the foods that we consume.
Okay.
And glucose is just the currency that the body will always feed on. Especially the brain feeds solely on glucose. Okay. So all these foods that we eat will eventually be converted to a form that it will be useful to the body. And is absorbed finally as glucose.
Okay.
So when we have that, if there is an excess in the body, if the body, after utilizing the watch, it needs to take, and then the excess is now left in the blood.
Okay.
This is what can simply be described as diabetes.
Okay, so when there's increased sugar in the body,
in the blood,
okay, in the bloodstream. So the sugar, when you finish eating, let me try to break it down. After eating, whatever you eat is converted to glucose, which is the smallest form. Then some part of it are used maybe for the daily activities we have, and then the ones that are not used are left in the blood stream. I thought normally they're supposed to be stored if it's not used, or it's what is making it not being absorbed.
Fine. That's what we describe as a general thing. We say it's a metabolic disorder.
Okay.
Normally, after utilizing the ones that the body should use, it's stored off as either other components that can be used to form muscles and other tissues in the body, which even during the fasting period, we only eat few times in a particular day. When we are not eating or when we're in a fasting state, the body calls back some of this stored energy into glucose that the body will continue to use and all that. So it can mobilize the proteins, like the muscles can be converted back to glucose. Then the same form that is also stored off as fat can as well be mobilized as glucose. So it's now when the body cannot store all the ones that the system have not utilized, then they keep on flowing in the bloodstream. That is when that.
So that flowing in the bloodstream is the problem.
Is the
that
problem.
Makes it really this. Okay, just before I go further to ask, from the statistics, it shows that there are so many Nigerians that are living with this. What's your experience like in the hospital? As in when patient walk in, I don't know, what's your experience like?
Diabetics in the developing world, we before now have been neglected, but with increasing awareness and obviously with our changing lifestyle, everybody wants to copy what is done in the Western world, and then we're also trying to limit the way we do our things. Our older parents go to the farm, engage in a lot of activities, but now we have things that, why we want to copy the Western world, we sit down at a place for a long time, we sit in our offices, and we don't get to physically carry out things. And so with that, we are not utilizing the glucose that had been absorbed in our bodies. And with that, Nigerians are coming down a lot. The statistics is even more than this, because these are the ones that are not that are even diagnosed, the ones that have passed through the hospital. We still feel that there are many in the communities who have not had an opportunity of getting into the statistics. Secondly, our diets have changed a lot. Everybody wants to eat what is quickly prepared. We want to eat the refined sugar products and all that, so that we'll join the trend. And that's that kind of lifestyle have really affected us.
Okay, let me talk about the types of diabetes. I know there's the 3 types, if I remember my school days. There are 3 types of diabetes, and I think the major one should be the type 2, which is giving us a bit of or just let's go over the 3 types of diabetes.
Yes, your 3 types had evolved over time now to even more than that, and more classification. But for the purpose of this particular program, to make it simple, we have the type 1 and type 2. Before now, it used to be called insulin dependence for the type 1. Insulin, because insulin is the thing in the body that helps the glucose to be absorbed.
So that's what tells the cells, look, take up the sugar,
take
and
up
use
the
them,
cells and take them up and all that. In type 1, we see that in those that have autoimmune diseases, those that and then they present much earlier. It's either that it's possible that there is a problem with the pancreas where the insulin is produced, or any other problem that has to do with the insulin metabolism.
So that one it occurs. You don't need, you're just born into it.
Yes. And all that. So that is why erroneously before now they used to call it insulin dependent, because the only problem with it was just the deficiency of insulin. However, because type 2 have also been found that at a particular point, for those that before now they were not insulin dependent, you can use your drugs to take care of them, lifestyle to take care of them, but at a point when they have been diabetic for a longer time, they still end up being insulin dependent because the beta cells have all been exhausted.
Okay, wait. So what you're saying is, even the type 2, which we've been saying is lifestyle, lifestyle, at a point, the beta cells where the insulin is being made is actually completely destroyed. So it's almost like you're going to type 1 now.
That's why that classification of type 1 and type 2 may not really be too correct, because invariably, for those that don't have a good control over time, they will still eventually need to be on insulin.
Oh wow, okay.
Invariably.
Okay.
And then there are also the ones that we'll now see in pregnant women. We call that gestational diabetics. These people are just okay, but because when they get pregnant, there is a lot of hormonal factors that come into play. Within those, when those hormones are released during pregnancy, you see that their blood glucose tend to be high within that, and after their pregnancy period and all that, they still return back to normal. However, those that have gestational diabetes have a higher risk of turning over to be diabetics
immediately after the pregnancy, or
not
maybe in the future.
in the future.
Okay, so those, I think those people need to also watch
it because
it,
they have a high risk of having type 2 diabetics.
Okay, so how is it diagnosed? When do you know, say that you're diabetic? Is it just when you have elevated sugar in your body, then you say you're at what point do you say this person is diabetic?
Okay, when we talk about making a diagnosis of diabetics, we will want to take a history.
Okay.
In the history, we want to know, most of them will come down with increased tests.
Okay.
They frequently need to take in water. And there's also, they can tell you that I eat more frequently. Because what happens here is that the ones that the body has taken in is quickly discharged and eliminated through the urine and is left in the blood. So they still feel hungry. The cells are still being starved.
Okay. All right.
So they still feel hungry, and then because of that, they still feed more. And when they still feed more, they are having increased tests, and they are still losing weight. So it's almost like a paradox. It's like you are in the midst of plenty, but you are starving. Okay. There's a lot in the system, but the cells are starving.
Okay, because this, now let me, I'm trying to reduce it in layman's. So because the cells are not absorbing the glucose, to convert it to energy, you keep eating. Yes. And then your sugar levels, as the glucose level is increasing in the blood, but your cells are not absorbing it, so you're losing weight. Okay, that explains why people lose weight when they are diabetic.
So they lose weight, they increase their feeding. We call it polyphagia. Okay. And also, they also excessively taking water. That can easily be explained by when you have a high concentration of glucose in the blood. Okay. It causes the cells are starved. There is dehydration in this particular patient, and the concentration in the blood is very high, more than what you have in the cells. In fact, by osmosis, more water is drawn out of the cells, so the body still reads that you are dehydrated. You want to take in more water, so that's why they come down with increased feeding, increased taking of water, and in the process they still lose weight.
So when you start noticing that, it's important for you to go
see your doctor. So when we have this history, we will have this. Then the next thing is that we want to examine this patient. By the time you are coming in, they may just not have any complication. They may not have any signs at that particular time. But the things that the doctor could look out for is that there will be weight loss, unexplained weight loss. There could be
weight loss, and you're eating very well, but you're losing weight.
You're losing weight, and by the time they are coming in, they may come in dehydrated. Their bodies are dry, and some of them can also come down with complication at the point you are seeing them. They are already having problems with their sight. Some could just come in with a numbness in the feet. Some could just come in with just a boil in the body. That could just be the first pointer. Then some could also come with a discoloration of the skin, and that could just be the only thing you are noticing. And then you combine this with your history, which you have earlier gotten from them, and then you send the person to the lab to do a test. At the point you are seeing the person, you probably, without any prior information, what we can do is what we call a random blood glucose.
Okay, that's generally any time of the day.
Any time of the day. By the time you are seeing this particular patient, you do a random blood sugar, and we have values that will tell you that this person is diabetic. For a random blood sugar that is above 11.1 per liter, it's a pointer that there's a problem.
Okay, above 11.
11.1.
Okay, above 11.1.
From 11.1 and above for a random blood sugar. Then you go ahead to do what we call a fasting blood glucose.
That's the one you tell it to come in the morning.
Come in the morning, take at least a minimum of 8 to 10 hours of not eating. And then we'll do the test. We don't expect your blood glucose to be above 6.1. Though Americans at 6.1 millimole per liter.
Okay.
Americans who are more conservative, even say by 6.1, there's a lot of problems. So they reduce their own values to 5.7 millimeter liter. So from that particular time, we look at a range of 4.1 to 6.1.
Okay. So the thing is now, so somebody's watching now and they notice that you are eating and you're losing weight unexplained. You're feeling thirsty all the time.
Yeah.
Yet maybe you're feeling dehydrated and your skin is not looking as refreshed as somebody who would have taken water. It's important that you go to your doctor and lay that complaint so that they can start, or early. I believe early dictation, like every other thing.
Obviously.
Yes. Early dictation should be what we used to. Okay, so we dealt on the symptoms. We'll go on a break now. When we return from the break, I want us to talk on management of diabetes, because I know there are lots of people. It's a big problem. Diabetes is a big problem. And then I want us to talk on management, how you can manage it when now you've seen that there's a problem.
Yes.
All right, we'll be right back shortly. Welcome back, viewers. Before we went on the break, we were discussing diabetes, and we've talked about the symptoms, how you can know you have diabetes and what exactly it is and what it's not. And my guest is still Dr. Chibuike Chimdi. He's a specialist family physician at the Maitama District Hospital in Abuja. So before we went on the break, we talked on the symptoms, and I want us to talk about management, which is where we want our focus to be on today. Now you found out that you have diabetes. Where do you start from? Because at this point, it's sad to hear that news that you're diabetic. Where do you start from? How do you start managing?
Because diabetics had been said to be is a chronic medical condition, so it's a disease that what we call is a multidisciplinary approach. Everybody is important in the management of diabetes.
Okay.
We will need the family members, we need the community, we need the specialists, your primary care physician. We also need maybe people that's the specialists that also take care of the feet, dermatologists, and even caregivers. Everybody, because it's a disease that affects most organs in the body. The complications can range from having problems with the eyes.
That was the one I read that actually shocked me, that there's blindness linked to diabetes.
Blindness. That could just be the very first of the symptoms that you could see. It can affect the kidneys, it can affect the feet, to the point of even having some of the sores that people come down with, and they tell you that a lot of things in different societies.
So we can link this whole kidney failures and kidney issues we're seeing. There can be a connection between kidney issues and diabetes. In fact,
the major cause of kidney failure currently is from diabetes.
Wow.
Yes, that's a fact about it.
Wow.
Diabetic nephropathy is a major cause of kidney failures now.
Wow, this is not very serious. Okay, so management here.
So in managing your diabetic who you had presented to you, remember, we have made a diagnosis from the history. These are things you see, and you get to see your doctor. The doctor looks at the lab and gets the diagnosis with our range, a particular range for the laboratory. Any figures that is more than 7 millimoles per liter for the fasting and more than 11.1 for the random. The doctor makes that diagnosis. Anything above that, the mainstay in the management is that there should be a goal. You have to get the consent of your patient. The doctor and the patient have to be together in it, because you need everybody have to be on board. Part of the care is that you make the patient own the care. It's something you can do through methods that we call self-monitoring equipment. These are things that the patient you have to teach the patient. In a broader view, the first and most effective, which had also been seen, is that dietary and lifestyle modification is a major way of managing diabetics.
Wow.
When we talk about lifestyle modification, the food and also how active the individual is.
Okay, food and your physical activity, which is what has actually reduced over the years. We've started eating, I don't understand what we eat these days, and people don't work out a lot. Okay.
Yeah.
Okay.
So coming down to the food, before older doctors or older managements talked about there is a diabetic diet and all that, but the current management says manage the patient in the milieu, normal thing the patient eats, normal environment, normal activity or normal food in the environment. So that is the way you have a better control. But for the physician, it's now the quantity that is important.
Okay. The quantity.
Quantity is the important thing, because you will need to reduce the carbohydrate components, increase protein components, vegetable and fruits.
Okay, because carbohydrates is responsible for the elevated, well, not only carbohydrates, carbohydrates is the main reason you have elevated glucose in the blood. So you want to reduce carbohydrates. Okay. Increase protein.
Okay. And also increase vegetables.
Okay.
Vitamins.
Okay, vegetables and vitamins. Okay.
And other fruits that are available. In fact, we encourage more of the vegetables and the fruits, because they also contain what we call antioxidants.
Okay.
That helps the body to even be healthy, prevent the infections that will occur when there is diabetes.
Okay.
Because in the bloodstream, when the blood is when there's a high concentration of glucose in it, you see that the person is susceptible to infection.
Okay.
They come down with all manners of infection. That's little wonder people say if you are diabetic and have a wound, it's hardly wounds.
Yes, I had an aunt who had that issue. She just had a wound, and that was the beginning of the problem.
Yes, and that is the...
Okay, let's talk about this food thing in reducing carbohydrates. Okay. In this part of the world, we eat a lot of carbohydrates. Yes. I mean, if you see somebody's, what we call eba, the gari, and you have the semo, you know, you see it's so big, and then there's one small bowl of vegetable soup that, you know, are we reducing that? Or by what quantity do you advise that a person reduce because that's and then we have rice, we eat a lot of rice here. Yes, we have a lot of yam, we have potatoes, we have all of that. So which one are we reducing for somebody that is watching at the moment?
You know, from the introduction, we talked about the important thing in this care is that of making sure that the person eats the normal milieu and normal food that they're expected to do, because that helps to take care of depression. Because in the past, people are left to say diabetic diet, every other person eats something else, and you are eating food that are not interesting, food that are not delicious, and they end up dying off because of the complications of depressions earlier than
we actually had a talk on depression on this program, and he said the same thing about diabetes.
Than just the problem. So what we advocate for in an ideal, if you can visualize an ideal plate, half of that plate should consist more of vegetables and fruits.
Okay.
Half.
Okay.
Then just a quarter. Remember, we say glucose is the substrate that the body feeds on. The brain feeds exclusively on glucose. So we still have to give the brain some level of glucose to feed on. So if we're visualizing an ideal plate, just a quarter of what we eat should comprise of the carbohydrate. And it's better to have fiber containing carbohydrate and not refined glucose in any form.
So when we're talking about fiber containing, we're looking at brown rice,
regular rice, but not polished, not there are a lot of things at the market, spaghetti and all that are already processed foods.
So when you take the food, just look at the label and see if it's it should prefer more, it should have more of fiber, you know, rich in fiber. Okay.
And that should just form 20%, 25% or 1/4 of our plate. Then the other 1/4, you do more of your proteins, and we advise to do more of white meat, which is preferred over red meats.
Okay.
Remember, we talked about in the courses that lipids, that cholesterol has a role to play and all that, and red meat has a lot of cholesterol in it. So when you take fish, which is the example of a white meat, and chicken that is skinned, is a form of white meat, as just 1/4 of that. But then the other half should be based on your vegetables of any sort, cucumbers, garden eggs.
Yes, the garden egg is another beautiful one. The garden eggs, cucumber, yeah.
And your vegetables, pumpkin, ugu, and
ugu, yeah, your ugu leaf is good. Spinach is good as well. So once it's green, it's good. Clean it well and then take it. Then that's for food. So for the food.
For the exercise and increased physical activity, it's been documented that most obese patients will eventually come down with diabetes. We didn't really have time to talk about what could be the causes, but obesity is a major cause of diabetes. And then the aim here will be to make sure that we reduce weight. And what is advocated for increased physical activity. You can either do at least 30 to 45 minutes of aerobic exercise most of the days. When we say most of the days, we expect at least 3 to 5 times in a week. You get to do an active aerobic exercise.
That's like walking or jogging,
brisk walking, dancing, and anything that could just
make you use up some form of energy. Yeah,
and you have to do that at least 45 minutes in at least 5 days in a week.
But you can do this before you even come down with the diabetes. But when we talk about prevention, we'll talk about the things to do, you know. So, and another one could be, I was reading somewhere and they said, you know, some people like to take their car in, park it in front of the office and walk into the office and walk back. You could park your car a little further and then just take a walk to the office. Or you could even park your car and just take a walk around, you know, if you're down with diabetes. So I've looked at 2 of them. Our diets and then exercise
and all that, and just
management.
Just to add to what you have, that's a more practical way of explaining to whoever that has the risk on how to take care of it. You know, because of our busy schedule, people say, I have to move from my house to the car and from the car to, I have a very busy schedule, but you can incorporate that. When you have lift in your office, prefer to use the staircase and go as much as possible. Don't be too relaxed and be a big man in your office that you will always send people to get up at intervals to check on someone, do some other thing, and with that you're increasing your physical activity.
So don't sit for too long.
Don't sit for too long.
So we've seen the food, we've seen what other management, your medicine, or
we talk about pharmacological care. That is for those who have met that diagnosis, and we have different drugs that we can actually use, like metformin, Dianil, and a lot of things that people use. But for the purpose of this, your doctor knows the very best of what drugs to do. We advise that one, physical activity, exercise, and then we'll start the patient on the metformin. That's the normal glucophage everybody knows about, and then we increase this based on what we are seeing. However, there are some patients that will be coming in at a very high blood glucose level. In fact, the first presentation will just be somebody who is unconscious. The glucose level.
Wow. Okay.
Yes.
This elevated sugar is capable of making you
unconscious. That will be the first presentation.
Okay.
And when the patient comes with that, the doctors also know how to manage that, which will include, first thing in this particular patient is to rehydrate the patient.
Okay.
When we rehydrate the patient, we're able to now start taking care of that particular person. There could also be, from the first diagnosis, we'll use insulin to bring down the blood glucose level if it's so high. So for the pharmacological component of it, your doctor will be at the best to take that decision, because it's patient-centered. It's just the person you are seeing, the level that is presenting to you, that you take the decision whether I'm using insulin at that point or I'm using any of the tablet form of it. But what cuts across everybody is that of the diet and exercise. Then another important thing in the care of diabetics is that when you have gotten the blood glucose to a level that is comfortable, we examine the eyes, because there are complications. In fact, by the time we start having a high blood glucose, there are already small complications we call microvascular complications already occurring. And these are things that can affect the eyes. So we'll check the eyes. We'll do a kidney function test to make sure, because as I said, it's a major cause of renal failure. So we'll do that. We'll also check the legs. Sometimes the very first time the patient is presenting, they just have a feeling of having foam-like feeling on their foot.
Foam-like is if you're not feeling your numbness, okay, you're not feeling your legs, okay.
All that. So we'll check that. And for every time your diabetes is coming to you in your clinic, we need to take out time and examine the feet.
Okay.
Because it's a very important part. Just like we have agreed that their wounds will always not heal that easily, because the glucose component forms a milieu for microorganisms to keep on growing.
Okay, we'll go on a break now. When we come back, maybe we'll just conclude on the part of the what we were just talking about, and then we'll not talk about, let's conclude on management, and then we'll go over to prevention.
Okay.
We'll be right back, viewers.
As a person with diabetes, it is important for you to care for your feet properly every day. If you have nerve damage, known as neuropathy, you may not feel pain if you injure your feet. Because of this, an infection can develop without warning. Decreased blood circulation slows healing. This can result in foot ulcers, which can eventually lead to amputation of the feet or legs. Prevent foot injuries by wearing shoes that fit well and have good support. Don't walk barefoot. Check your shoes before putting them on for small pebbles, worn areas, or rough spots. Avoid sandals, pointed toes, high heels, and plastic shoes. Always wear socks in your shoes. Socks are better if they do not have seams or mended areas. It is important to check your feet every evening for cuts, sores, red spots, swelling, or infected toenails. If you have any of these problems and they do not heal within 24 hours, it is important to contact your healthcare provider. If you have trouble seeing the bottom of your feet, try using a mirror. Before bathing or showering, test the water to make sure it is not too hot by using a thermometer or your elbow. If you use a thermometer, between 90 and 95 degrees Fahrenheit or between 32 and 35 degrees Celsius is safe. Water that is too hot can damage the skin. Do not soak your feet, as they can become dry and cracked, causing infection. Be sure to dry your feet well, using a patting rather than a rubbing motion. Be careful to dry between your toes and use talcum powder or cornstarch to keep the skin between your toes dry. Apply lotion to the top and bottom of your feet to keep them soft. Do not apply lotion between the toes, as this can cause the area to become too moist. Thick or hardened skin on the toes and bottom of the feet, called corns or calluses, can appear from skin rubbing against bony areas of the foot. If you have corns or calluses, it is important to talk with your doctor about how to remove them. Do not use corn plasters, corn and callus removers, or blades, as these may lead to infections. trim your toenails straight across once a week. Smooth sharp edges with an emery board or nail file. Contact your doctor if they become thick or yellowed or begin to curve and grow into the skin. Avoid using heating pads, hot water bottles, or campfires to warm your feet, and carefully check your feet during cold temperatures for frostbite. Keeping your blood glucose levels in your target range through healthy eating and daily exercise can prevent or decrease nerve damage caused by diabetes. Daily foot care, comfortable shoes, and having your healthcare provider examine your feet at least once a year can help minimize serious long-term damage caused by diabetic neuropathy.
Welcome back, viewers. Before we went on the break, we were discussing how to manage diabetes. And my guest is still on the program. Is Dr. Chibuike Chimdi. He's a specialist family physician at the Maitama District Hospital. Dr. Chimdi, thank you so far.
Thank you.
Thank you so much for all this information. So now, okay, we're talking about management, yes, of diabetes. So I think we stopped at where the doctors. Yeah, no, we talked about the doctors. Yes.
Okay, the doctor have to make sure that you check the eyes, check the kidneys and make sure that there are no wounds and anything on the legs, and then make sure that there is no numbness of any type on the foot. And then, in fact, if you have the time, it's advised that the cutting of the nails is actually done by somebody who is trained to do that, because the patient can actually injure himself in the process of cutting just the nails, and it will just get there to what we call diabetic foot, which will eventually get gangrenous, and most at times that's when we need to get in the orthopedic surgeon, that sometimes patients are told that you may have to lose your limb in the process and all that. So it's something that we want to make sure that they don't get to that point. And then also, because you remember from our definition, we call it a metabolic disorder. Other diseases we also check for them, like hypertension and cholesterol, increased dyslipidemia.
Now this is very serious, because it's not just, so diabetes is not just one thing, it's a body of complications.
A lot of problems.
Wow. Because when you're just talking about this, I just wanted to point points out that I think I had an aunt who she was diabetic, and she had a wound, just a small wound on her leg, and she went somewhere, obviously not a hospital, and they inserted something in the leg, and they called it a particular name in Igbo, in my local Achere, and they put it there, and they told her not to allow anybody to touch it. And but I remember when she came, we got to the hospital, they took out the thing, and after with her taking her medication, after some time it got better, but she didn't continue with the medication. They had to amputate the leg, and eventually she died of it. So that is just to point out that it's very important, when you notice the symptoms. So another one will be when your wound isn't healing, isn't it? It's one of the symptoms. Okay, so what's happening? So what do we do when the wound is not healing?
When the wound is not healed, it's also a pointer that your blood glucose is not well controlled. Remember, as part of the symptoms I mentioned earlier, we talked about multiple boils. Could just be the first thing. Someone notices that I have a lot of boils in my body.
Boils?
Yes, just as innocent as that.
As in the normal boil that grows on your skin?
Just normal boils that grows on your skin. Could just be the first pointer. And by the time that's the thing the patient is presenting with a high index of suspicion from a clinician, you will request for blood glucose level. Most times they are usually elevated, and then you get to treat it. The issue, just like I've explained, is that when there is a lot of blood glucose in the blood, it forms a medium that every organism will want to grow in. Every microorganism can. It's just a little experiment we can do. Just get a glass or a cup, put sugar in it, and allow it open over a while. You can see a lot of microorganisms that will grow, because most organisms feed on glucose. So no matter how much you treat you have to be very, very aggressive with antibiotics care before you can actually get rid of some of those microorganisms. And that is why prevention is a very important part of care in treating diabetes.
Now, you just brought up something, that's the prevention.
Yeah.
I think that's the next thing we want to talk about, prevention. Because, you know, in fact, the first question I said I was going to ask you was, you know, they said if your parents, if you have somebody in your family who's had diabetes, then you're most likely going to have them. But is it possible that you can do the right thing and avoid becoming diabetic if you have a family member who had it?
Very, very possible. The truth is that most of the problems that we'll see would say gene loads the gun, but our lifestyle pulls the trigger.
All right.
So we can
gene loads the gun, and then the trigger is the lifestyle. Okay.
The lifestyle pulls the trigger.
Pulls the trigger. Okay.
Pulls the trigger. Yeah. So there are a lot of most of this diabetes is a disease that we get from our parents. It's loaded from the gene. There are things you can't do about that. Other things is increasing age. There are things you can't really do much about that. And then, as I said earlier on, for those that had gestational diabetes, those that had diabetes during pregnancy, they already have a higher risk of having diabetes, coming down with diabetes. As I say, but these are already things loaded in the gene. But with lifestyle, we pull the trigger. We can either progress with developing diabetes by just our lifestyle, diet, exercise, and the way we carry out our life, or when we also have a very strict lifestyle, we eat the right meal, be physically active, we can actually eliminate
any risk of
developing diabetes. In fact, there are a lot of studies that have been done and that had really seen that care of diabetics have improved. With more than a lot of studies done abroad and all that have recorded as much as 31% reversal rate.
Reversal completely?
Yes, complete reversal.
Okay.
Based on diet and exercise without a pharmacological treatment.
Okay.
And all that. So it's something that we can actually do when we face it and live the right life.
Okay, I like that part, which means you don't necessarily have to get diabetes. Diabetes is not stopped on anybody's name.
No, not
but if you can live right and exercise, then you should be able to, you know, prevent yourself from coming down with diabetes. And does it start at any particular age? Do you need to start it early in life, or you wait until you are 40, then you start jogging?
Recently, now there are already diagnoses of diabetes type 2. Funny thing, you remember in our first introduction, we talked about type 1 being for the young,
for the younger
and all that. But now we have recorded type 2 diabetes in less than 10-year-olds.
10-year-olds?
Yes.
How did it?
Because of lifestyle. The gene has loaded it. We have a lot of obese children.
Hold on a minute. So the children, 10 years, or somebody who's 10 years is coming down with diabetes, he's eating enough sugar for his, or he's taking enough carbohydrate for a lifetime. Is that what you're saying?
Obviously, in our environment, we see a lot of very obese children.
Yes.
And that's have just been, some parents think it's an evidence of good living. Evidence of you are feeding the child very well. And at a very young age, the body cannot utilize the glucose that be supplied. And the beta cells get exhausted that it cannot even cope with the metabolism in the system.
So what are these children eating? Is it the normal food that we all grew up eating, or they're eating more of refined sugar, or what are they eating now?
In our system and in our society now, everybody wants to eat on chocolate. There are kids that just feed on refined meals, refined food. The packs that we give them to school, you see a lot of refined kind of thing. Nobody wants to talk about professional or good food.
Okay, with good
things
nutrients.
Like with good nutrients, fruits, and giving them natural things.
Wow.
Everybody wants to give what is trending. They feed on golden more milk, and that's just
that's so loaded with so much sugar and
loaded so much, and that is just what it. So they get obese at a very young age. They come down with diabetes at a very young age. So it's not before. We don't say, we used to say from a particular age group we start screening, 18 and above. But now, when there are obvious risk factors like obesity,
yeah.
we screen the patient. As no matter how small the child is, 10 years, 12 years, you screen, because they have the risk factors, which include obesity, which includes very poor lifestyle, sedentary lifestyle. And
of course, children these days don't walk around again. When I was little, we played a lot, but now everybody sits in front of the computer and plays game and
all that.
Wow. Okay, so that's for children. You know, they need to watch what they eat. So if there's a parent watching and your child is taking in so much refined sugar in drinks, in foods, it's time to start changing it, because children can actually come down with diabetes.
Yes.
Okay.
So in talking about the prevention, just like we have talked about, we've given that example for that. It's something that awareness have to be done about it. Everybody should have to know that it is not just a disease of the old. It also comes down in the young. And then it's also an awareness that everybody have to know that diabetes is not like, my parents were diabetic, I must come down with diabetes.
Okay.
You
can do something about
you have the right to reverse whatever thing. And then we also talk about care that we receive for those that we have met the diagnosis of diabetes have been done. It's not like a death sentence. You can actually walk out and get to reverse, and you are no more within the range that will lead to complication. As well. And then we want to take it at different levels. For the parents, we encourage them that make sure that your child is physically active. They are not limited behind the computers or restricted within the house or just limited to a very small space.
They should come out and move around.
Play and get active, physically active. Then it's also for us to know that being fat is not an evidence of good living. It's not an evidence of good living and all that. In fact, for us, it's a form of malnutrition.
But it's not only children. There are older men who have big stomach, and which is very common now. I see so many people with big stomach, and and I read somewhere that that's even once you have that, especially in the abdominal gates, it's part of the
measurement that you have to take in making your diagnosis of first obese patients. There's already a risk factor for diabetes.
And obesity, I know you have to measure BMI to say, because not just expect that because you're slim and looking not too big or too over big or too over weights in size, but there's a BMI measurement.
It's a simple parameter anybody can actually get to. It's body mass index, which measures your weight over your height. Squared. Your weight in kilometers. In kilograms, sorry. In kilograms. Your weight in kilograms. When you measure that, then you measure your height and you square it. That will give you the body mass index. A normal range of 18 to 24.5. It's a normal range, normal BMI. Then between 25 and 29.5. It's what we call an overweight. But anything from 30 is obesity. There are also other classification of class class 1 obesity, class 2, and then morbid obesity. But anything above that, it's not a good BMI for you. So everybody should work towards getting a normal BMI.
That's between 18 and 25.5.
Yes.
Okay. All right. Okay. So that's still talking about prevention. Now, I want to talk about caring for injury when you're a diabetic patient and you have an injury. What are the things to do when you have an injury? Of course, it doesn't heal, but as I said, my aunt got better until she stopped, treating herself well. So what are the things you do to take care of the injuries when you're diabetic?
Fine. Since the first thing and most important thing is to prevent
the injury from
happening.
happening.
That's the first and the best thing to do. Prevent the injury from happening, and making sure if the injury does not occur, we will not have the problem. However, for those that are already diabetic, we encourage regular check on the foot, regular check on the hands, regular monitoring of activities that we engage in. Don't get so exposed. If you are a farmer, make sure you wear things that cover your foot, and make sure you don't come down with any form of small injuries and all that. But when it occurs, it's also good to report to your healthcare provider. At that point, if there is an injury and there is an infection ongoing, irrespective of the stage you are, part of the care is that you are treated with insulin, because we want a radical reduction in the blood glucose, and also a high dose antibiotics to make sure that there is that the antibiotics are eradicated, because they will keep multiplying at a very fast rate. And then general hygiene, to make sure that we keep the environment clean. We talked about being a multidisciplinary illness that you need everybody's hand to be on. Caregivers should also be taught. They should also be able to dictate this early. Make sure that they caring for this particular patient, so that everything is clean, and then make sure that even the people preparing the food is brought in the management of these patients. Whoever that prepares, the chef or the wife and the family members, knows what the patient should eat. And it's also good to have a psychologist keep talking to this patient, because it's a chronic illness, and because it's a chronic illness, they can also come down with mental health issues in course of the care.
So I even like the part that you talked about their family coming in to help, because just as you said, it's not just the caregiver, it's everybody that's involved in taking care of this patient that has come down with diabetes. And then it's also important to see a psychologist, because it's actually a depressing moment. I can imagine there are things you were doing before, and now you can no longer do it. So I wanted to ask, there's also the monitoring. I think there's the you can monitor yourself if you are how expensive or how cheap are they? I don't know if you, because why there's somebody that's watching now who is just living carelessly. And I'm going to ask about alcohol as well, and smoking. But before that, somebody might be watching and think, oh, I have a lot of money. If anything happens, I'll just use my money to do. How expensive are these medications? And is the government doing any form of subsidy? Are you giving us any subsidizing this medication by any chance?
On the average, point of care testing, it had been the base of treatment, and in most government hospitals, to have a glucose test done is on the average of 500 naira per testing. And the glucometers that we use for self-monitoring, as I said earlier, it's part of the care. We encourage the patients to own care. When you own care, you should know basics of checking your blood glucose, recording it, taking your medication, having a good adherence counseling, so that when you're on medications, you have to keep to it and not to skip. And making sure that you also go for your follow-ups for the multi-organ that could be affected in the process. And the self-monitoring kits, on the average, about 7,000.
7,000. It's still expensive for some people. So the best thing is not to even get there. Don't even just monitor your lifestyle and most of the things we talked about today. Now, alcohol and smoking. I know it should be a factor. It could bring you down, or can it?
Very well. Very well.
So how does it work? Alcohol and smoking.
we talked about the diabetes being a problem with the metabolic process, and we talked about insulin being a major factor that helps in maintaining a good life and making sure that the metabolism of glucose is done well. Cigarette smoking and the nicotine in it can actually affect the pancreas. Pancreas is an organ in the body that secretes insulin. And then when the cells, we talked about beta cells, are destroyed, they can't produce the insulin. So the nicotine affects these parts where the insulin is produced. And when where the production is affected, you see that they can't really regulate the glucose. So nicotine.
So nicotine is in any form,
cigarettes and all the other things it will be
it can destroy the beta cells.
Then alcohol on itself will eventually be broken down to glucose.
Oh, I see. Okay.
So when that happens, you could see that it's also increasing the blood glucose level. And when the with the consumption of alcohol is increasing the end product, which is glucose, and
then you shouldn't
still taking it up.
Any form of alcohol.
Any form of
red
alcohol.
wine, all of them.
Any form of alcohol
shouldn't.
Any form of alcohol.
Any form of alcohol should not
alcohol will still increase the blood glucose. And when we talk about lifestyle modification, we now talk about smoking cessation and even current trend. Before we used to talk about alcohol reduction. Now it's now talking about alcohol cessation as well.
A lot of things has to change for you to manage this diabetes. We've even run out of time, but thank you so much for the discussion. So much information. But if there's one thing I learned, I know I didn't know it affected the eye that bad, that fast. Most of the kidney infections we have today has a linkage to diabetes. Now, diabetes is not just an ailment. It's not just one thing. It affects a lot of other things in all the organs in the body. So it's important, number one, to improve your lifestyle, exercise. In fact,
more. Even for families it has, diabetes had also torn apart families because of erectile dysfunction, which is
another factor,
a major thing that nobody will tell in the clinic, but that is a major symptom that the patient will come in first with, and they just keep battling it, and families are broken because of that.
So it has the complication is just too much, but it can be prevented. It can be prevented. So watch your lifestyle, exercise more, eat more vegetables and fruits, and reduce carbohydrate if you can, even as a normal person who is not suffering from diabetes. So for the fact that a member of your family had diabetes doesn't necessarily mean that you will come down with diabetes, because it can be prevented.
Yes.
Okay. Thank you very much, Dr. Chinbi. We've learned so much today, and I believe our viewers that are watching have actually learned today, about diabetes. And if you have a family member who is living a careless life and just eating everything and not exercising, or your children might even be the ones that are at risk, please begin to talk to them and help them to live a better life. I am Angela Wednesday. I'll see you next time. Goodbye.